Good morning. Thank you, Dr. Grover, Azad, Rao, Ravinder, and my friends. See, my talk is about cutting cost and maximizing returns. Now, this, I am not a doctor who is practicing. Secondly, the cutting cost is required for the corporate also for the individual surgeons, also for the NGOs, everybody. So it is a universal talk. I am thankful to the scientific committee chairman who chose me for this. Now, up till now you were listening the corporates, the individual, then the rural practice and all other, and you were happy. Now, as I am a dean of medical college, and I am teacher, so teacher is always bitter. So when my next slide comes, so don't curse me. Now, surgeon dream. He want a multi-storied hospital, then the costliest car in front of multi-storied hospital, the all costliest equipment inside the hospital, crowd of the patient wherefrom he can't go inside this one, and all this above he want in the first year of his practice. Now tell me how this is possible. And unless and until you think on this, you can't solve your problem. So you will have to think, if you want all these things, I will advise you go join corporate hospital and think that hospital is yours, problem is solved. So that is what, because you will have to accept. It may be a corporate, it may be NGO. So don't feel that they are doing some other thing. Think that, yes, because of them you are improving. So I think that is always good. The other thing is patient dream. Patient feels he should recover his vision to 6/6. He should not contract any infection. He should not require any second surgery with the second surgeon. And he want minimum visit to the hospital. If visit are reduced, the money is reduced. So again you will have to think on that issue, how you are going to call the patient. So this is what I want to tell you second. Now the challenges. The cutting costs, what I feel, it shall not affect quality. That is very, very important. So when you are cutting, don't cut for the quality. Then the developing pricing, that is the affordable to all. You have to think where you are practicing. Tansu just told that if he is charging 55,000 or 100,000 for one cataract, nobody will turn. So you will have to think that also. The balancing cost with the revenue. Otherwise, it will happen a different way, then you will have to close the practice and join corporate or NGO. Developing mechanism for placing the patient in the proper price category. That is very, very important when you are thinking this. Now here, as I am a dean, this I was not doing before 2 years. Now I become a dean. Optimum use of the manpower. I will give one example. I called my professor of ENT. He was having 3 tables and then 32 people. His pay one day of that total OT was 2,42,000 and he was operating one tonsil. So the tonsil price for me was 2,42,000, which was in Lilavati only 35,000. So there you will have to think that person should do minimum 10 tonsils so that the price will come to the 24,000. So you will have to use that optimum manpower. Otherwise, so many people, para-nursing are there, paramedics are there, technicians are, doctors are there. Then the another meeting I hold with the ophthalmic surgeon in my other hospital. A surgeon drawing 1.5 lakhs per month operated 2 cataract in 6 months. So you can imagine how much is the cost of that cataract. So you will have to advise them, unless and until this manpower is used optimally, you can't do anything. Then the another thing is the race in the trade. The trade is coming to you and so much of the race. My equipment is good, my is good, you can pay me half part, you can pay me full part, like that. You have to think what you want to buy. If you are buying very costly equipment, then you are whatever you will have to give them is very big amount. So don't buy very big or you can very costly equipment to begin with. It should be you can say basic equipment you should buy. And that optimum use. Now I have brought a laser in government hospital. If you are doing only one surgery LASIK, that one LASIK You know the gas price is 18,000 per day. So that will cost more than that. So you will have to gather patient together and then operate. Same is the FECO. Otherwise, cassette and everything 3,000 cost and you are operating one patient. So the cost of the surgery increases. So that you will have to use. Now rationalizing the use of disposables and drugs. So now what happens? Disposables we are using, but you can autoclave and use once, not much more than that. But the drugs, you know, you are using Helan. We don't know how that is going to help, but it is very costly. You can just use methyl. There is no cellulose or like that. But we are not thinking in that term. The results are same. The drugs, another thing is, there are steroids and corticosteroids, these antibiotics together 10 rupees. But we are writing 65 rupees. Why? Mere pressure of the people who are called as pharmaceuticals. Because they are just taking us for the fly, then being the hotel like that, and then we are writing, but who is paying? Patient. So that you will have to think. The patient will go to the other doctor because he is just writing the drug which is 10 rupees and you are writing the drug which is 65 rupees. That also you will have to think whenever you are thinking for the patient. Now the another thing is race in the community and colleagues. When your patient is seen by your other colleague, he will tell, क्या वाट लगाया तुम्हारे आँख का, क्यों गया था? Don't criticize your colleague. You are talented, okay, but has also passed MS. If he is a new one, say yes, whatever he has done is good. Now what I can do, I can help you this, but don't criticize our colleague. See in other departments, you will see in the retina there is less criticism because vision is PL to hand movement. But in cataract, there is so much of the criticism. So this should not happen. So consumer cases are not in retina, but they are in cataract. So don't do that. So that will not help you. Now what cutting cost, but what about the cuts? The all practitioners, they are going to ask you the cuts. So basically you will have to give the cuts. There is no any other solution. But in that cuts you will have to see rose yourself. Patient will not go to him, directly come to you. So no cuts. So like that you will have to see problems in the super specialty practice are so many. Super specialty, see, if there is a retina surgeon, he will not get the patient. Then you will have to send the patient, and then that retina surgeon had to satisfy. I have seen the persons satisfying the people who are sending, and so many parties are organized. I was witness one party, and I was ashamed of myself that I am an ophthalmologist. So these things should not happen. We are so grown-up people, and in this we must think of the public and India, name of the India at large. And lastly, whenever you are thinking everything, are we remembering we are for the patient? No. We are not remembering we are for the patient. We are not for the nation. We are remembering we are for us, self, only self. Don't remove yourself and work for others. That will help you. Thank you.